So first of all, really well done on having a tooth taken out. I know it's quite a scary process, but now I'm going to run through some instructions with you on the next steps, what to do. The first step that we should look at is the main concern, and that is always bleeding after a tooth has been taken out. What I'd like you to do for the next 4 or 5 hours, please avoid any strenuous exercise, nothing that's going to get your heart rate going. If bleeding does occur, you will find the dentist should have given you a pack to go home with. Inside the pack is all the instructions I'm about to go through. You will also find a spare pack. All you need to do is bite down on this pack as you were doing at the dentist and bite down it for 10 to 15 minutes. One of the other things is how long will the anaesthetic last afterwards. You can expect the anaesthetic to last for another 2 to 3 hours. It will start beginning to wear off after that. During the time, please avoid fiddling with the wound, sticking your tongue or your finger in it, just so we can stop it from bleeding any further. And in regards to some further instructions, starting from the day after you've had your tooth out, we really want to keep the site where the tooth has been taken out as clean as possible. So how we would do that is avoid rinsing for the first 4 hours, but starting from tomorrow, I want you to get half a teaspoon of salt, some warm water, and dissolve that together. I don't want you to rinse it, just place it in your mouth and just let it work for about 2 to 3 minutes, and do that for the next 2 to 3 days. So for the next few hours, whilst you are numb, I would suggest to avoid any hot foods. Try your best just to stick to the cooler foods. You are very numb for the next 2 to 3 hours, so please just avoid the hot foods and the hot drinks and stick to room temperature foods for us. The other thing is, if you are a smoker, please do your best to avoid smoking for at least a week, and at the very least, the next 2 to 3 days, okay? The main concern, like I've talked about, is any excessive bleeding, any undue pain, and if that is to happen, please do contact us back at the earliest opportunity.